Aloha mai kako. My name is Veronica Mendoza. As Ruben said, I am the Executive Director of Roots Reborn. We stood up in the aftermath of the fires knowing that Lahaina had a really large immigrant community. Those of us who live here knew that. It turns out a lot of people who don't live here don't know that. So I think it was really surprising for folks when a lot of information just kind of started coming out that, our Lahaina folks actually had double the national average of foreign-born folks in Lahaina. And myself, coming from an immigrant community myself, know that these numbers are actually underrepresent the actual numbers because we have a lot of folks who lack status and are not accounted for typically in these types of census datas. So, in our work at Roots Reborn, we've never turned anyone away, but our niche really is our folks who lack status and the COFA community. It is safe to say that we work with the most underrepresented, chronically and historically underserved community that's now directly impacted by the deadliest wildfire in US history in the last century. This is our data, and I'm not going to talk about our data, but you can find our data on helpingmaui.org. It is the most comprehensive data that exists on our immigrant community in Lahaina that was impacted. We at Roots Reborn, we're your community organization. This is us. It is unlikely that you'll find another team, definitely on Maui, probably in the state, that is made up of 100% bilingual, bicultural staff. Our team is deep-rooted, not just in Lahaina, but with the community that we serve. We have deep-rooted connections because we have a shared lived experience. And so what this allows us to do is basically really catapult our level of trust with the community. They're able to connect with us a lot more easily. We speak their language. And it's not just verbal, right? It's also the way we greet each other, the way that we listen to each other, and yes, the way that we communicate in written and how we disseminate information. But it's so much more than that, right? We stood up to really meet immediate needs were language support and document replacement, because a lot of our folks needed to have their documents replaced by different countries. So we supported a lot of consulates to come out, and we supported a lot of our folks to go through that process of replacing their documents. We also, 3 of the co-founders of Roots Reborn actually happen to be attorneys. I am not an attorney, but they were able to support document replacement pro bono, which made that first critical step really easy, because we knew that in order for them to qualify and actually successfully apply and receive resources, which we already knew was going to be really difficult for them to begin with, right? But we knew that first critical step needed to happen, and we were able to do so at no cost, low barrier, and as quickly as we possibly could. We're recognized for the trust that we've built with our community, but fundamental to our work and a core value of Roots is really the belief that the trust that we have with our community is reciprocal, right? So, everyone says, wow, like, you guys have so much trust with the community. Like, how do you guys do that? Well, part of it is that when they come to us, we also extend that same type of trust to them. That has to exist. And we take that into our professional relationships as well. And so we've carefully developed over the last year, relationships with other community organizations, and I see some friendly faces in the room. But today I want to talk about the synergy between a community organization like Roots Reborn, MauiWES, and Kaiser. And while very similar to Ruben and Alika's presentation, there could be dozens and dozens of other partner orgs, but for this, I'm gonna just kind of focus on these, on the 3 besties up here. So The partnership with MauiWES and Kaiser has really resulted a year later in really life-changing aid. And again, foundational to this has been not just reciprocal trust, it's reciprocal trust that's being driven by data. So I'm not gonna spend a ton of time on talking about HHAP because I know David's gonna spend some time on it, but basically it's free healthcare. It's free healthcare for people who are unable to get healthcare in any other way. That's crazy, you guys. So when Kaiser approached us, we were like, okay, wait, hold on. Let me get this straight. And we did a training, we went through it, and I'm like, and they approached us and they said, do you think you have community members that qualify for this? We're like, all of them. And they're like, can you help them? I'm like, say less. We got this. And so this program effectively plays a pivotal role in addressing the healthcare needs of individuals that fall through the cracks of the existing system. A lot of folks in our community are not covered by employer-sponsored health plans. They lack the financial means to purchase insurance on the open market, and they face exclusion from state-funded programs such as MedQuest and Medicare. So for the families that we work with, who are fire impacted, who are survivors, that already have a hard time accessing resources, qualifying for resources, navigating resources, HHAP, it's a lifeline. It's a source of inclusion, support, access to essential health services that they've been systematically denied. So for survivors, this means that we're supporting their recovery in a really meaningful way. So HHAP is filling a major gap in recovery. And it takes this type of effort and decision to actually move the needle. And folks like Kaiser that have deep pockets can do that. So more people like that should be doing this. Okay, so I'm gonna take you really quickly through a timeline, okay? And kind of just to show you how the relationship is synergistically working, right? So we did open enrollment last year, starting in November. That was just a few months after the fires. And it ran from November through January. We successfully enrolled 120 individuals. We collected a ton of data. So the other thing is that we realized and we recognized very early on that no one had any data on our community and everyone was asking for it. How many people? How many people? Household size, ages, what their needs were. And so early on, we decided that we were gonna collect systematic data as much as possible wherever we possibly could. And this was one of the first ones. So when we started open enrollment, we asked folks a bunch of different questions, but I'm just highlighting a few of them. So we enrolled 120 individuals. 89 of them were fire impacted. 94% were receiving healthcare insurance for the first time in their lives. Median age, 44. 100% of the folks that we supported, foreign-born and limited English proficient. So that means every single person that we supported through the application process and successfully enrolled, we did so in a different language. Our team speaks Spanish, Pohnpei, and Chuukese, and some Marshallese. By the time that the program ended, we had 21 people on the wait list. And the reason we had 21 people on the wait list is because when the program started and we were trying to get our community in, no one was coming in. And that's because they're like, I don't believe it. Free healthcare? What's the catch, right? And we really had to work on explaining and convincing that this is a charity program. It's a private program and nothing gets sent to the government, basically. And so it wasn't until a few weeks after the first enrollees were receiving their insurance cards, like the floodgates opened. And at the time, we had a staff of 2. So we did as much as we possibly could, and when it closed, there was 21 people on the wait list. And then right away, we're like, David, open it again. And then, so we're running the open enrollment, and then we meet Ruben and Alika. And they're like, hey, you've been identified as a community partner org that we think we should be working with. We think you should be involved with this. This is what we're trying to do. So you have The principal investigators of a community-based research long-term study is an immigrant and Kanaka Maoli. I'm like, say less. I want in, especially because the design of it was really by community for community. And really what this meant was that they wanted to reach the community because they wanted it to accurately represent the makeup of the community that was impacted, which means that in doing so, we were ensuring representation that is acutely needed for our community, and that we're able to develop additional data on their emerging and immediate and emerging needs, and hopefully be able to resource them based on those needs. That got a little wonky, but again, we work on reciprocal trust, and so there are a lot of the 4 players here are community members. You have the community organization. You have large institutions that are service providers like Kaiser, and in this case, the academic partner who, the reason why we're here and we're showing up is for our survivors. And these are folks that are interested in making sure that no one gets left behind, regardless of status. And so what this is effectively creating is a missing loop between community members and the trust that is missing between these bigger players, right? We kind of have to walk them into the door. And ideally, then the community organization is able to move on to bigger and better things, which means more support for our community. Okay, so then re-enrollment rolls around in August. Do I have time? I'm good. Oh, okay. So re-enrollment rolls around in August. And so again, we're trying to collect data because we want to know what is happening in our community. Also, we recognize that 94% of folks were receiving insurance for the first time in their life. So we're like, are they even using it effectively? Like, what is it that we can learn so that we can better support our community? Well, half of them don't have a PCP, didn't have a primary care physician, and 15% didn't know if they had one. So immediately we were able to pivot when we started seeing this trend, and before they left, we're like, let's make an appointment. You gotta get seen, right? 100% had not used any of the mental health resources available to them. And then on the positively is 90% indicated that having Kaiser had a positive impact on their lives. Okay, open enrollment. We're in open enrollment right now. By the time we open enrollment, just last month on November 1st, we had over 200 individuals on the wait list. 200, over 200, including women and children. So 60% of applicants are women. 60% will be receiving health insurance for the first time in their lives if their applications go through successfully. 45% of beneficiaries or folks who would be beneficiaries have minors at home. And I think that's a really important thing to talk about, is that when we talk about folks that are mixed status, undocked, we fail to recognize that while we're talking about adults, they often have children at home. And our data shows that there is hundreds of kids in these households. So when an adult or a parent goes underserved, that means that directly impacts those minors at home. 30% of our applicants have moved between 2 and 7 times since the fires. So there's still a lot of housing instability. 40% have experienced rent increases. 42% self-report that yes, they would like some help navigating their new health insurance if they were to get it. And then 100% of our applicants are foreign-born and limited English proficient. So basically, this is transformational, right? So when we're at MauiWES and we're getting referrals, or we get folks that don't have insurance, we're automatically adding them to our wait list so that there is a pipeline to be able to support their recovery. And then we have Kaiser, who is making it easy for these individuals to get health care. And ultimately, the focus comes back to the community members. This is why we're here. This is why we're doing it. It's to serve the community members. It's to serve the survivors in meaningful ways. And so I want to applaud Kaiser. I want to applaud MauiWES for really the work, their trust in us, because we're brand spanking new, and for really collectively, I think this shows collectively how we're able to deliver some of the most effective aid that this community has ever seen on Maui, ever.